Ontario is bracing for a severe flu season now that masking is no longer mandatory and other public health measures have now been lifted. As you can see, the shortage of children's pain and fever medications continues. So we take a look at what to expect in the coming months and how to stay healthy.
It is back to school time now. It's going to get colder. We're going to be indoors. So, the risk for respiratory disease goes up.
John Papasturgio is a pharmacist here on the Danforth, and he expects flu cases to skyrocket in the coming months after infections were at record lows for the last 2 years due to public health measures.
But you got to remember, everyone was masked. We were being very careful. There wasn't much travel anymore. Now everything's opened up. People are traveling all over the place.
The Southern Hemisphere is normally a good predictor of what's to come, and Australia is reporting its worst flu season in 5 years, with the virus arriving early and hitting children the hardest. According to the country's Department of Health, kids ages 5 to 9 had the highest rate of flu cases.
The last couple of years, a few people got their flu shot, a few people got the flu, so there's kind of a lack of immunity to floating flu antigens out there.
Dr. Kashif Prasada is a Toronto ER physician. He worries about the pressures this could put on the already strained healthcare system.
I don't know any hospital in the GTA right now that's not short of workers. Like basically some places can't fill 10-15% of their shifts coming up in the fall. You combine that with flu, combine that with COVID or whatever else is coming our way. Let's say some crazy new variant comes our way. Then, we're all going to be in big trouble.
Health experts say we can use lessons learned from COVID to protect ourselves during the cold and flu season. Stay home when you're sick, mask up in crowded indoor settings, and roll up your sleeve when flu vaccines become available in the coming weeks.
Are you at all concerned that there's so much vaccine fatigue out there that people are just tired of rolling up their sleeves and may not come out for the flu shot?
That's what I'm afraid of. It's hard. People have been through a lot. But the thing is, what's out there is constantly adapting to try to get us. We have modern technology that can save us, and you do not want to end up in an overwhelmed hospital.
Once the vaccine's available, there's a lot of ways you can get vaccinated. Make an appointment. You could use our apps to make an appointment. You could walk in and just drop in, and anyone could get really sick. The flu is not a joke. Like if you've actually had a case of the bad flu, you could be in your bed for 2 weeks, right?
Now, when it comes to the children's medication shortage, I'm being told the pharmacies should be getting ample supply by mid-October. Shauna Hunt, City News.